It's time to check in with our beauty experts at Sweatnum Cosmetic Surgery. Amber is here to talk about hormones. This segment sponsored by Sweatnum Cosmetic Surgery. Thanks for being with us, Amber. Great to see you.
Thanks for having me.
Yeah, absolutely. Okay, now we've heard of the term hormonal imbalance. What exactly is that?
So as we age, our hormone production changes. Starting at age 25 for women and age 30 is the earliest that you can see hormone changes. So those changes can either have too little or too less of effect, too little or too more of an effect on your hormone balance and the symptoms that you can experience that are unwanted, like decreased libido, fatigue, memory issues, those types of things that are just not very, they don't make you feel well.
And they come from a hormone imbalance. That's what it stems from.
Yes.
Okay.
Yes.
Interesting.
I mean, there's other underlying causes, but yes, hormones play a huge role in how you feel.
Sure.
And you specialize in ways to kind of treat that with hormone replacement. Tell us a little bit more about that.
Yes. So at Sweatnum, we use the BioT hormone replacement method. And what that is it's a natural hormone that we use using pellets. It's about the size of a grain of rice. And what it does is it's either testosterone and or estrogen. And based on your levels, we replace your hormones to kind of help with those symptoms.
Sure.
And it's a natural occurring, so it's the same molecular structure as your body produces.
Okay.
Okay. Is there a difference between, because the pellet you're talking about, it's injectable, is that right?
Yes, it's we place it underneath the skin superficially.
Okay, because then I know sometimes people take those hormone replacements orally.
Yes, so oral replacement and or injections, those are more synthetic hormones. So those usually have the increased risk of like breast cancer and blood clots. BioT uses natural hormones to replace.
Sure. Anytime we're talking about, injection and things like that, people want to know, okay, is this safe?
Right.
Yes, yes. So BioT, which is the natural hormones, those have been around for years to come. There have been many studies that have shown that it helps improve dementia, bone health, cardiovascular health. So it is very safe. It's about the size of a grain of rice.
Yes. Yeah.
And we place it superficially under the skin, kind of on the buttocks area.
Okay.
Yes.
Yeah. And I've heard this before. There's kind of a fear between hormones and breast cancer, right?
Yes.
Is that a myth? Can you break that down for us?
No, it's a very important question. So, there are hormone-driven breast cancers. And so those patients who have a history of breast cancer, we do treat differently. And again, like I said, the synthetic hormones are the ones that have the more increased risk of breast cancer and blood clots. These that we use are natural. So they are the same structure as what your body produces. So definitely we treat you differently if you've had a history of breast cancer. It's not a contraindication, but it definitely can, alter the way that we treat you.
Sure. Yes. Yeah. And speaking of that treatment, when will it start to work after you have the procedure done?
So everyone is a little bit different, but you can see relief in as little as 4 weeks or sooner.
Wow.
Yeah.
Okay. And then how long does it last?
So it's different for women. Women usually about 3 to 4 months, and men is about 5 to 6 months.
And then do they come see you again, I suppose, to re-up?
Yes. So typically what we do is, your first round, we pellet you, and then if you're a male, you get post-pellet labs at 4 weeks. If you're a female, you get them at 6 weeks, and we kind of see where your testosterone levels are and your estrogen levels are. If they are within our goal range, then the next round at 3 to 4 months for a woman or 5 to 6 for a male, we pellet you the same amount.
Okay,
Yeah.
yes.
Yeah.
And how do folks get started? They're watching the interview right now. Maybe they're interested in learning more. Maybe they want to start. What's the best way to do that, Amber?
So really just call and make a consultation with me. We go over your medical history, your medications, all of that, and we draw your labs. And we don't have to pellet that day. You just come, we talk about it. We see, answer any questions that you may have. Then based on your lab work, that's when we'll be able to pellet.
Yeah.
All right, Amber, thank you so
much.
Thank
you.
Before we let you go, I just want to say, Jason, your Botox looks so great.
Oh, thank you.
Your nurse practitioner is fantastic.
Amber treated me really well when I went to Sweatnum
it looks
Cosmetics.
fabulous. You look so young.
Yes, I know. Sign up for some Botox too. It's absolutely amazing. I love it.
Thanks, guys.
Thanks, Amber.
Thanks so much.